Hello, and thanks for joining me, Nurse Julie at Hospice Real Talk. My goal is to provide useful information about the dying process that will help educate anyone who is losing a loved one to understand what is happening ahead of time so that it's not so scary when you're actually going through it. I am not a doctor by any means, but I have had the privilege of standing at the bedside of my dying patients for many years. In addition to that, I invite anyone who has had their own personal experiences to share their stories in the comment section below because knowledge is powerful. So with that being said, here we go with topic number 7, educating about unnecessary medications. If you or a loved one has been diagnosed with a terminal disease and have been referred to hospice services, and you are taking a handful of medications, I can just about guarantee that some of them are not only unnecessary, but also could be doing more harm than good. Your liver has to metabolize all of what you put in, and all that medication has to go to the right receptors in your body. When a body is ill, most especially if it's your liver that's compromised, then what you put in yesterday hasn't even metabolized out yet, and you're putting in today's. Then tomorrow, you might still have a little from yesterday and today's, and now you're putting more in. So not only is the meds not getting to their destination and doing what they were meant to do, now you have too much medication in your system, which is toxic. It's going to make you sicker faster. So the first ones to go are vitamins. Your body can only accept so much of any one vitamin anyways. And if the patient or family insist on continuing them, at least suggest one multivitamin a day rather than 12 different individuals. Then you might look at statins, cholesterol meds. Is the person even eating that much anymore? Look at diabetic medication. Also, make sure that there isn't too many blood pressure medications on board. You don't want them to bottom out. All that being said, if they are started on pain medication, then be sure to have a bowel medication on board. If patient or family insist on staying on some unnecessary medications as they decline, try to eliminate the least beneficial first and the ones that they are having a hard time swallowing. Not all meds can be crushed and put in applesauce or pudding, so they need to be mindful of that. They may have to use a whole nother route of administration, for example, rectally or buccally. If a pharmaceutical company ever discovers my little vlogs, they won't be very happy with this next one. But blood thinners in a dying person do not mix well. Xarelto, Eliquis, Coumadin don't do well in a failing body. That's my own personal observation, but please consult your hospice physician for their advice. Keep in mind, if the patient starts skipping a day or two of regularly scheduled medications and then takes a day or two and then skips a day here and there, then you might as well just stop them. Those kinds of meds that were prescribed to be taken daily need to be taken consistently to be effective. Eventually, the person is going to not be able to take any meds except comfort meds. And there's a variety of different ways that those can be administered. But that's another vlog. Now it's your turn. Share in the comment section below what you say to someone who is taking medications that the risks are now outweighing the benefits. Talk real and in a way that they can understand it. Thanks again for watching Hospice Real Talk. Make sure to hit the thumbs up button and the subscribe button so you don't miss anything. And check out my website, hospicerealtalk.com, for some more information. See you soon.